Welcome to Ask Sid, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back to Ask Sid, our official podcast. And today we are going to do a very unique podcast with a physician who actually does weight loss in the most unique way that modern medicine has around. You're not a therapist, and yet you know that the root cause of weight gain is emotional hunger. Dr. Adrienne Youdim, and if you haven't read her book, Hungry for More, you just have to pick it up. It talks about your own life. It talks about your patients, how you've decoded all the various hungers. I just can't wait to dive deep into some nice conversations around all the kind of hunger we all have.
Thank you. Me too. I love talking about all of this.
Well, before we talk about it, can you please introduce yourself? Because you were the first and the youngest head of the obesity medicine department at Cedars-Sinai. How did that happen? How did you get into this career? And you've probably pivoted 2 or 3 times in your whole medical journey.
Yes. Well, yes, doing obesity medicine was a major pivot. I actually was slated to do gastroenterology. I had matched in a fellowship to do GI. It was a highly competitive specialty. There was a lot of personal and family issues. I decided to have a child, and I always say it's serendipitous that I stumbled upon obesity medicine, but in going back and thinking about my own, journey in writing the book Hungry for More, I realized, like everybody, I had my own relationship with food and with hunger. And so in retrospect, there was probably a greater plan or a bigger design than just serendipity.
Right.
But I did fall upon it it just happened at the right time and in the right way.
So how was it in a traditional hospital system like Cedars?
Yeah, so, back 20 years ago or more when I started the obesity medicine program at Cedars-Sinai, there was a obesity program, but it was bariatric. It was purely surgical, which is how things were in most institutions. They had a robust surgical program, but they didn't have a medical component. And in traveling, around the country and learning from different institutions, I realized there were places in which they were doing obesity medicine. And at the time, unbeknownst to me, this was something that was kind of percolating under the surface and just really becoming prime time, because what we implemented at Cedars-Sinai, which was a comprehensive program that had medical and surgical weight loss services, was something that was going to become so much the norm that even third-party payers were going to mandate this kind of comprehensive care in order to qualify bariatric centers, in order to approve patients for bariatric care. So again, it really was, it was like divine timing that I stumbled upon this. It was something that I was passionate about, something that ultimately was of benefit to the patients, to the institution, and to the third-party payers. So it kind of, again, it was a perfect time for all of this to come about.
And then fast forward, you did this for 15 years or 10 years at Cedars?
I did it for almost 10 years at Cedars. And, I talk about these hungers, and I think a way to describe how I talk about hunger is like the itch. If we are attuned to ourselves, there are times in our lives where we have this itch where it's like, not necessarily that anything was wrong, because absolutely nothing was wrong. But I had an itch for something different that I didn't feel like I could do within an institutional setting. And so I did leave the program at Cedars. I continued practicing obesity medicine and clinical nutrition. I still do that in Beverly Hills. I prescribe the GLP1's. I do all those doctory things. But what the move allowed me to do was to explore more creative parts of myself, which then lent itself to exploring emotional hunger, spiritual hunger. And now, I don't know, it's been 15 plus years since I've left. I've created this whole kind of body of work around my way of perceiving hunger after working with literally thousands of patients now.
So let's dive a little deep into, and I totally agree with you. When people are overweight, very often it is a repressed emotional need that's acting up, and more rarely it's a biological or a genetic reason.
So I do want to say this because I think two things or both things can be true.
Right.
So from my, white coat physician hat, I can say there are certainly, physiologic factors that play into weight gain. There's definitely physiologic factors that make it very difficult for people to lose weight once they have gained weight.
Mm-hmm.
So from just, briefly to mention that from a evolutionary perspective,
Yes.
we were not meant to lose weight. Calorie restriction and weight loss is perceived as a threat to our survival.
Yeah.
So we have all of these mechanisms that when people lose weight, even if it's medically indicated, right? Even if it's better for their health, the body perceives that as a threat. So hunger hormones go up, metabolism drops, the way that we process fat in the bloodstream changes so that we don't lose weight, which is why I am a huge advocate of GLP-1 drugs in the right patient. That being said, this notion of hunger, which doesn't necessarily drive us or drive one to gain weight. However, it does drive every human, and I think every human has hungers, to either act on that hunger, whatever it may be, and we can talk about those different categories.
Yes.
Or if they choose not to, then we are almost forced, compelled, let's say, to soothe that hunger in different ways. Some of us may do it through eating, some drinking, smoking, people pleasing, overworking. Bottom line, there is an unmet need that is asking of us to change our way of being in this world. And if we don't respond to that need, then there is a discomfort that we then seek to soothe with something outside of ourselves.
And in your work, have you seen most often people are not aware of this hunger, or is it blatantly screaming?
I think both. I think a lot of times when people come and have the conversation in a setting in which is non-threatening, is open-ended, and I have to say, I think the fact that I'm not a therapist offers me even a greater advantage because there is, I think, some kind of barrier or self-judgment that occurs when people are going to therapy. In my case, they're coming to talk to me about a medical issue that they want addressed. But then when we start to talk about, what could be these underlying hungers, it is screaming in the room. And it is obvious to not only me, but the person themselves that perhaps they are in a relationship that is not supportive, or they are, stuck to a job that is not giving them purpose or meaning, or it could even be something very seemingly trivial, like they are not acknowledging their very physical needs for rest, sleep. They've been in a arduous job building their business or growing their company for the last 20 years. And that hunger is for, I don't like the term self-care, but self-care in a very practical sense. You need more sleep. You need to take a lunch hour, right? You need to move your body. And when you don't do these things, then they show up as an itch or a hunger to soothe. And I'll talk about something very practical.
Yeah.
which is, movement. I don't even like to call it exercise because in our society, exercise is synonymous to weight loss.
Yeah.
Well, there's so many benefits of exercise, physical, emotional, and otherwise, that are devoid of whether people lose an ounce or not.
Right.
But when you have that like pent up energy, that nervous energy,
Yeah.
maybe it's because you have a work issue, maybe it's because you've had a difficult conversation with a friend or a partner. It's like this negative energy, right?
And you just want to move or you just want to shift and you're
Well,
physically feeling it.
Exactly. We are physically feeling it, but we're not experiencing it necessarily as a desire to move. And so what do we do with that discomfort? We're like, oh, let me go to the pantry. Let me grab a glass of wine. Maybe someone needs a cigarette. Maybe I need to get back to my laptop. Maybe I need to scroll on my phone. But movement is literally a way to metabolize that energy, move it through and out of your body. If we started thinking about exercise in this way, in this day and age when everyone is feeling angst and reactivity,
Yeah.
it would be an absolute game changer.
Yes. And that's how they do it in the blue zones where people live the longest
Yes.
and happiest and, they're not obese. So it's interesting how you bring this whole aspect to weight loss. And when people come to you, do they know that this is what's going to happen? Or they're like, hey, I'm going to a weight loss doctor. She's going to give me GLP-1. She'll put me on a diet. And
I think the word is out on the street now because I've been doing this for so long and because I do have a body of work that's out there. People research you and, Google you or I guess chat GPT you now.
yes.
So anyway, I think it is known that I explore things in a different way, but I also think now there's a greater desire for that as well. I think 20 years ago, maybe it was more taboo or people just wanted the drugs. I think now there's a greater understanding and a greater appreciation for somebody who can approach this in a more comprehensive and holistic manner.
So they are coming emotionally ready to peel the onion with you.
Yeah, or they may not exactly know what's there, but I think there's an openness, and also I recognize that timing matters, and so I meet patients where they're at. Maybe the first visit is, let's just talk about the very practical aspects of my life, diet, exercise, sleep deprivation. And then, over time, when either we've built trust and goodwill, or because they've seen some changes and now they're reassured that they can take on this next level, for every person it's different. And for some people, they come in and they're like, look, I have been pushing this under the rug for the last X amount of years, and now I'm ready to address it. So I'm a huge proponent of not only us as, practitioners, as physicians and other service providers, meeting people where they're at, but also people themselves. I always tell my patients, meet yourself where you're at, wherever that may be.
You've allowed them space to wait till when they're ready. Okay, so tell us a little bit more about your book, the different types of hungers, so that maybe, we can walk away from today's podcast reflecting a little bit, what is my hunger? What's that hunger that's screaming the loudest at me?
So, the book is interesting because, I always say that I'm a benefactor of people's stories. As a physician who's seen now thousands of patients, who, now I also do speaking engagements and corporate work. So there's clients. So I've been in this position where I've met so many people from so many different walks of life. And I noticed that there is this common thread. There is this universality to our hungers. And for me, as someone who has the benefit of seeing all these various patients and clients, I can see that common thread. For the person who's coming to see me, however, there's often a lot of shame, a lot of discomfort. And I always want to, I always want to disclose, like, guess what? Jane and Tom and Sally and me, and the president and your favorite podcaster or, singer, we all experience the same universal hungers.
Right.
And so writing the book was really my way of leveling the playing field, of letting people know that you may not see it because you don't sit in this chair. You don't have the opportunity to meet hundreds of people a week. But trust me when I tell you, your experience is not unique. You are unique,
Yes.
but the experience is universal.
And you're not alone going through this, feeling like
Absolutely. I mean, that is the undercurrent
Yeah.
that I wish to relay, is that the experiences are universal. You may have, your own flavor to what is happening,
yeah.
but the underlying current is universal. And I think that gives people lots of reassurance, lots of validation, and that common humanity piece is actually a critical component of self-compassion. When you recognize that I am not alone, that actually this is a common human experience, then one is able to say, "Ah, okay, now I'm ready to tackle this, because I know that I'm not alone." So that was really the intention behind the book. And um, the TED Talk that I did, that is kind of a little micro version of the book. And then, the hungers I've tried to, because what happened was people read the book and then they said, okay, well, I get it, but how can I identify the hunger? Um, and how can I wrap my brain around it? So I've tried to categorize these various hungers and to give people kind of methodologies, so to speak,
Right.
of how to identify your hunger, which we can get to. But the hungers basically are in categories of spiritual. I'm sorry, let's go back to the basic,
Yes.
which is physical, emotional, relational, and spiritual. And so physical is like the basics, right? Are you meeting your basic needs? Are you making time for food and nourishment? Are you moving your body? Are you getting adequate rest and sleep? The science is very clear.
Yes.
That when you don't get nourishment, and it's not just food nourishment, but in all the ways,
Yes.
that your body reacts. And hunger hormones actually go up not only when you don't eat, but when you don't sleep.
Yeah.
So sleep deprivation, avoiding that nutrient of sleep, actually raises the very hunger hormones that we are trying to manipulate with these drugs.
Absolutely.
So that is the
Foundational.
Thank you. The base tier of unmet needs, which leads to, in this case, physical hunger. The next one is, emotional hunger. And that is, do we feel nourished on an emotional level? Do we feel seen and validated in our experiences? Are we having self-compassion for ourselves? All of the ways in which kind of that emotional weight can, and by weight I don't mean physical weight, but
Yes.
burden, that emotional burden can play out.
So physical hunger is foundational, like you said, and then we talked about emotional hunger.
And so
Tell
now
us
we're
about emotional hunger.
So the emotional hunger can. So let me back up.
Yes.
So emotional hunger is all the ways in which we meet our emotional needs. So, for example, are we feeling seen and validated? Not necessarily or only through other people, but through ourselves or by ourselves. Do we have self-compassion for ourselves in those difficult moments when we meet our own imperfections or limitations? Are we giving ourselves permission for the wide range of normal human experiences and for what comes up? We talked about pivot earlier, the desire to do something different or experience something different. essentially, are we nourishing our emotional selves, our emotional lives?
So it's not just like others are emotionally meeting your needs. You first ask yourself, am I loving myself? How am I loving myself?
Correct. And I would say because, we'll talk because the next step is kind of relational hunger, that the emotional piece really is dependent on ourselves. However, it does relate to our relationships because oftentimes we do not um, either we are not aware or we do not accept where that relational experience is not meeting our needs. And so that is where kind of self-love, self-compassion
Yes.
meets external love, external validation and compassion. Because perhaps the next hunger, the relational
Yes.
hunger, is not being met, but you are not allowing that to be known, which is really a misgiving on our own personal emotional side. But if we were to go on and talk about relational hunger, that then is yes, are we in a relationship in which we are feeling supported, secure, validated, seen, met? And by the way, are we doing that for the other person as well? Are we taking time to foster and to maintain supportive relationships? And that's not just romantic, but also platonic.
Yes.
So many of us women who are busy moms, busy career people, don't put that time and attention to platonic relationships, and we suffer as a result.
Yes.
Right? When we are sitting at the dinner table with our partner or with our patients, with our children,
Yes.
is the phone away? Is our mind now, in tuned or attuned to what's happening or what's being said at the dinner table? Are we even making time for family dinners?
So all these things collectively can add up and really lead to a lot of weight gain.
Absolutely, because and it's on several different levels. Uh, Number one, from a very practical perspective, when we talk even about family dinners, for example,
Yes.
there are studies that show that families that engage in dinner around the table have a lower rate of obesity than those who do not. Or families and individuals who eat without technology are less likely to experience excess weight or excess weight gain. So there's a very practical,
Absolutely.
eat with your family, don't eat with screens. But then there's this
Because you're
other,
meeting two hungers at the dinner table. You're meeting your emotional hunger, actually all your hungers. You're meeting your physical hunger and
Yes.
your relational hunger.
yes, it is an opportunity to really nourish yourself physically, emotionally, relationally, and even spiritually, which we'll get to.
Yes.
But the other piece to all of this is that when we have discomfort, uh, it gives rise to difficult emotions. It gives rise to stress.
Yeah.
And that stress also plays a role in terms of our hunger hormones as well. So there's also this very biologic component to our unmet needs. And we can talk about that. But before we do, just rounding it out with
Yes.
this spiritual hunger, which really relates to are we walking in the world in a way that is meeting our deeper spiritual needs? Do we feel like we have a sense of meaning, purpose? Are we connected to something bigger or broader? And this doesn't have to be in religious terms. It can just be even, am I working for an organization or a company that I believe in my core is contributing to something that is important to me? And for one person, that may be human rights. For another person, that may be animal welfare. For another person, it may just be, beautiful homes.
Yeah.
Because we know that when people are happy in their spaces, they live better lives. They're more emotionally stable. So that that thing is different for different people. And so when these various hungers are not met, there are practical breakdowns and implications that result in excess weight or the desire to soothe in some way, whether it's food or otherwise. And then there's also even this biologic component because it leads to these difficult emotions that we know at the level of the brain
Yeah.
from a neurotransmitter and chemical perspective give rise to changes in your gut hormones that then again promote hunger.
Yeah, it's a whole cycle, right? That's why at Sydenham we have 7 pillars of health, and you can't just take any of the pillars out. It is nutrition, gut health, genomics. Like I have every single fat gene that exists, right? Uh, but again, your genes are not your destiny. How they play out with your hormones, how am I sleeping, how am I managing stress? It's that whole dance. And I think where medicine is going today, having the opportunity to have a relationship with your physician and you allowing them and giving them the space to have these conversations,
Yes.
I think like that's missing from traditional medicine.
Yes. And the fact that it's not either or, right? Like people always say, oh, so, you address the emotional piece, but I'm
Yeah.
more than happy to prescribe a medication.
Yeah.
It is not either or. It is the ability to address the biological factors, give people the tools and resources, even if it's, bariatric surgery. I
Yes.
still work with the surgeons, who do this work.
Yeah.
And
Yes.
to bring in these other pieces of people's lives that really allows them to live well. And if we were to even just zone in on the weight loss piece, right? There are many circumstances in which people have been battling excess weight all their lives, and they think, oh, if I just get this one part under control, my life will be so much better.
No.
And they take the medication is effective, they lose. I mean, I've had patients who've lost over 100 pounds,
Yeah.
and then they're like, oh, why is everything not perfect or the way I envisioned?
Yeah.
Because that is one piece of the
Yeah.
whole picture.
Yes. I mean, it's beautiful the way you've really had the guts or the courage to address weight loss, especially from such a traditional medical training. It must have been so hard for you to step away and really listen to your own gut, listen to your intuition as a woman, um, as just somebody who's a person of your own faith, somebody who's in touch with your own spirituality. Um, and I feel a lot of physicians get so lost in treating, that this side of their personality gets buried, sadly, in the healthcare system.
You know, we're not trained. Not only are we not trained, but I think a lot of classical training in multiple disciplines. I mean, this is really a societal issue
Yes,
that
it's a
is
systemic
beyond medicine, but it forces us, or at least encourages us, to step away from our intuition.
Right.
And, we can even bring this point back into the work because patients will ask, or readers of the book will ask, okay, I understand the hungers, but what if I don't know? Or what if I'm experiencing all of them? How do I know what's most pressing? And you know, uh, I'm a huge fan of having your tribe and your team, your
Yeah.
physician, your psychologist, your coach, your,
Yeah.
podcast, whatever the case may be. But I always tell my patients, you and only you know what is your next best step, what is your right decision.
So you empower them?
Yes. And that is where the mind body piece comes in because I'm also trained in mind body medicine.
Right.
And so then exploring breathing practices, writing practices, drawing, all of these various modalities to help people listen to that intuition
Right.
because that voice is there.
Yeah.
I can't tell you what your voice is,
Right.
but I can help you perhaps slow down enough, give you the modalities so that you can
Hear it.
tune in and hear that internal voice.
Well, thank you. This was really refreshing to shine this light on weight loss, because a lot of people are going to watch this podcast on weight loss and think we're going to be giving them nutritional tips and talk about the benefits of GLP-1. And we're like, no, we really want you to go inside and listen to your hungers. So yes, this is going to be a unique podcast because people are going to come in thinking, oh, it's on weight loss, and we're going to hear about GLP-1s on what to eat, what not to eat, maybe move more. And your message is no, pause. The answer lies buried within. It's one of your hungers that you haven't paid attention to. And listen to that tiny little voice, and you give them a lot of tools to help them identify what their hungers might be, because it's not so easy. It's easier said than done.
Absolutely.
Before we wind up, is there anything else you'd like to share with our listeners? We're excited to be, working with you. And really, I feel like this is one aspect that needs to be bought in, because we do everything that we can on the genomic side, the nutrition side, the gut health side. We make sure that whole biological piece is there and they have a good relationship with their nutritionist and the physician. But some people don't really need a therapist, or the therapist is addressing their marriage issue or their children issue. But adding this one layer on, I think, is just magical.
Yeah, I mean, I agree. And I would say that particularly in the times that we're living right now, because there is so much outside noise and because our lives are so very fast paced, that this is a particular time, a unique time that we can take advantage of all of the resources at our disposal
Yes.
to further empower ourselves to do this work. And I would also say that while sometimes we can get excited or impatient with ourselves, that this really is, it sounds cliche, but it is a process.
It's a journey.
It
This
is.
is life.
I tell my children this, I tell my patients, and by the way, I remind myself
Yeah.
because I know that for every moment in time, there will be another layer for me as well. And so it's really approaching it with this light touch so that we can be gentle with ourselves and give ourselves the permission to explore in a way that is self-serving and nourishing.
Well, with that, I'd like to wrap up today's podcast and thank you for helping us pause and really reflect that, we're all humans and weight is not a physical issue. Weight just as well could be an emotional issue. And we look forward to maybe reading your book. And I think when you read your book, it's very pensive. Like, you also start reflecting and relating it to your own needs. So I think it's a great start. But you also have your website, right, where there is a course that you're going to be launching. Tell us all about that.
Yes. So I do the mind body work. There's a course that right now I do kind of more one-on-one or in a small group setting. But we are launching a online course for people who want to take this work at their own pace. And just get a taste of what's available.
Yes. Well, thank you so much. And we should have you back on our podcast in a few more months, and look forward to all the great work you're doing.
Thank you. It's a pleasure to be here.
Thank you.